Dr. Henrietta Ewart, Director of Public Health in the Isle of Man, you have produced a new substance misuse strategy. It's going to be laid before Tynwald this month. It replaces a drug and alcohol strategy. So another strategy? What does this mean?
Well, there's a couple of points there. Firstly, I haven't produced the strategy. The strategy is a cross-government strategy because clearly issues around substance misuse need action across government and in fact beyond. Second point, we had a strategy, why do we need another one? The issue there is that a strategy is a rolling process. Things change, patterns of drug use change, the harms that are being experienced change, the evidence for what should be done around them, that might be treatment, it might be legislation, that changes. So a strategy isn't do once and you've done it forever. A strategy is part of a rolling cycle which really has three parts. Starts with needs assessment, because if you don't know what your issues are, who's affected, what they're affected by, what the interventions are that might help that, then actually you can't have a strategy. You've just got stuff out of the ether. It has no grounding anywhere. So you must always start with your needs assessment. Then you can develop your strategy, which sets out clear but not necessarily deeply detailed strategic objectives of what you're going to do over a defined period. And normally that would be 5 years, because a 5-year period should be long enough to actually get traction with the changes you want to make, but it's not so long that actually everything has changed and the pattern of drug use and the latest evidence on treatment, etc., is all different.
Is there an overarching vision for this? Where do you want to be in 5 years?
Well, the overarching vision is divided into different work streams. There's one about prevention and education, one about treatment and rehabilitation, one about legislation and enforcement, and one about governance and data. And that's actually key, because if you haven't got a framework within which you're monitoring and evaluating what you're doing, and you're not collecting the data that shows what's happening and what changes are occurring, then you haven't got a clue whether your strategy is doing anything. A strategy is not just a wish list on a piece of paper. You've actually got to have a mechanism that is going to drive change.
That's interesting. Let's drill down into that mechanism. I believe you want to actually attach pieces of work, you mentioned work streams, to people's job descriptions. And so that is actually disseminating it, cascading it through a wide variety of different departments and divisions by the sound of it.
Yes, indeed. There is core ownership and oversight and overall accountability which sits with the Substance Misuse Steering Group, and that includes the chief officers of DHSC, Department of Health and Social Care, Department of Home Affairs, and Education, Sport and Culture.
So this needs driving, as well as people doing the work that is allocated to them.
Exactly. And accountability and monitoring, so that if people are not doing what they've committed to do, the steering group will identify that and actually ensure that mitigating action is taken to bring it back on track.
We've talked about it in quite abstract terms so far, so let's sort of get down to the nitty-gritty. What sorts of things do you want to see going on? Let's say in treatment and rehabilitation.
In terms of treatment and rehabilitation, we need a clear specification. So that is a document that sets out, based on best available evidence, exactly what treatment should be offered, to which patients, so that people can get access to the level of service they need at the time that they need it, and that the outcomes of that service are monitored to ensure that as many people as possible are getting the desired outcome.
What about education and prevention? Because some public awareness campaigns will tell people what they should be doing and what they shouldn't be doing. How can you, I suppose, for this to be really successful, you need to change the culture and change behaviours? That's
absolutely right. Part of that is about simply imparting information. For example, safe drinking guidelines, information and advice on drugs and their likely effects, but just giving people information, whether that's adults or children and young people, won't change behaviours. And particularly if we're thinking about the sort of work that we need to do with young people, that has to be very much in the context of giving them life skills overall. So simply knowing that going out and binge drinking is bad, could lead to risky behaviours, poor decisions, bad outcomes, won't necessarily stop them doing it. They need to have that knowledge about what drugs and alcohol can potentially lead to, but within the context of a wider social education agenda.
Yeah, you talk about equipping them with the skills to say no or to resist it. What will you hope to see in 5 years?
Well, we'll hope to see an improvement on our outcome indicators. Interestingly enough, the trend for alcohol use amongst young people is very much coming downwards, and that's something that's being seen across the British Isles. So in some ways, young people already seem to be behaving more responsibly than some of the older folk, in fact. So this isn't necessarily, in terms of harm reduction, it's not necessarily all about working with children and young people. There are issues about working with older people as well, and this is a group where that perhaps hasn't been realised previously.
Should mention that within this you declare that in terms of the Public Health Directorate you're in favour of a minimum per unit pricing for alcohol. Where are you up to with that?
We're certainly in favour of it, but not just us in public health. That is something that the whole steering group, so that's cross government, also strongly support. So there is commitment to that, and there is a commitment to it in the strategy to take that forward.
So when Tynwald members have had a look at this and they've had a presentation from yourselves in public health, it's going to be accepted and laid before Tynwald. So when do you hit the ground?
We are already working on the implementation plan, and it's a generalisation and somewhat of a truism, but a strategy is just fine words on a piece of paper until such time as it's supported by a detailed, costed, accountable implementation plan.
With deadlines?
With deadlines, with people who are responsible, specific tasks, projects that they're going to deliver, and a reporting mechanism and a monitoring and evaluating mechanism.
Well, it will be fascinating to see how this pans out. Director of Public Health for the Isle of Man, Dr. Henrietta Ewart, thank you.
Thank you.